Like many of your peers in internal medicine, you may be thinking carefully about your future. If you are considering nephrology subspecialty training, I invite you to visit Washington University in St. Louis Nephrology Training Program. We focus on where the field is going, not where it has been, and develop an individualized curriculum for each fellow. Whether you are interested in home modality dialysis, transplantation, ICU nephrology, interventions, personalized medicine, or simply to be the best nephrologist you can be, we will prepare you for that future. And we will do so in a supportive and friendly environment where a good work-life balance is valued by faculty and fellows alike.
The world of nephrology is changing, and we are committed to training fellows to be at the forefront of that change. We offer the nation's largest home dialysis program, one of the world's most successful transplant programs, and state-of-the-art care for the critically ill involving every form of renal replacement therapy and plasmapheresis.
You see the bread and butter of nephrology, yes, but you also see very rare presentations.
The fellowship focuses on all aspects of renal care for transplant patients, not just the immunosuppression, but the complications that come from having a transplanted kidney, as well as the general nephrology and the chronic kidney disease that develops after transplant.
And I think this is absolutely one of the programs with the highest number of patients in the home modalities clinic, be it a home hemodialysis or a home PD.
Washington University and Barnes Jewish Hospital, with 1,300 beds, serves as the primary referral center for parts of 9 different states. As a fellow here, your influence will be wide and far-reaching. St. Louis is a major metropolitan area, nearly 3 million strong, and our diverse community offers something for everyone and exemplifies the wonderful Midwest quality of life.
It's an amazing city. The people are so friendly. There's so much to do here.
St. Louis is not a big city, but it's not a small city. It's in the medium, so it's actually perfect. It's a perfect place to raise the kids.
There's so much for families to do here. People with kids, they will never run out of anything to do. My favorite things to do are to go to Forest Park and to have this enormous park sitting in the middle of an urban area where you can get away and have some quiet is wonderful.
This is actually a place that I want to settle down in the future.
I love it here. I love it here.
Equipped with this clinical excellence and the opportunity to participate in groundbreaking research, you will embark on your career with the confidence to provide the best care for your patients, as well as contribute to the medical community at large.
We have a great pathology department, an awesome nephrology pathologist who we sit down, we look at the pathology together, we understand the pathophysiology about the disease, and we process to the treatment, then we follow up on the patient. So I think it gives you a complete experience. You don't only diagnose, you diagnose, treat, and follow up.
There's lots of research that you can participate in. All of our attendings, they have their own niches that you can actually work along with.
Every faculty member has some research interest, and whatever is in your mind, you can work with them and explore what your own goals and objectives are down the road.
And also the caliber of cases that we see. So putting it all together, it's just an amazing program.
Watching people get kidneys and say, you've saved my life, you've given me a new life. People that are sick and on the brink of death from liver disease and they get a liver kidney and all of a sudden go from being critically ill to walking out of the hospital a week after their transplant. It's remarkable.
You really get a sense where they want to make you ready to be a good nephrologist at the end of the road.
I think this is an experience nobody should miss on.
I chose WashU because I want to make a difference.
By choosing a career in nephrology, you will contribute so much to so many. By deciding to continue your training at Washington University School of Medicine, you will have chosen to make a difference in the future of our field. That is my personal promise. I look forward to seeing you here.